Welcome back. We'll continue illustrating the opportunistic infections by talking about cryptococcus neoformans. Crypto is really not much different from the other systemic fungi in terms of its clinical presentation, but there are some unique diagnostic strategies for crypto that will actually really help you out in realizing the stem is talking about crypto. So we do spend a good amount of time on the diagnostic aspect of crypto, but before we get too far ahead of ourselves, let's set the scene. And this one is a no-brainer. Our scene's going to take place in an Egyptian crypt for cryptococcus. Our main character will be an archaeologist who is cleaning and inspecting the crypt. First, we'll go over some general characteristics. Let's start by drawing in two sarcophagi. Sarcophagi, plural for sarcophagus, are of course the funeral receptacles in which a mummy is buried. And as you can imagine, if you're wealthy enough to be buried in a massive crypt during Egyptian times, you probably didn't want a little flimsy, economical sarcophagus. No, you wanted a big, honking, impressive masterpiece to encapsulate you and protect your mummified corpse for centuries. And just like these mummies are encapsulated in these heavy sarcophagi, cryptococci are known for being heavily encapsulated. So when you hear heavily encapsulated, think sarcophagus, then think crypto. Also on the sarcophagi, notice this repeating pattern of circles. This is to remind you that the capsule of cryptococcus has a repeating polysaccharide capsular antigen. This is an important concept you need to remember for crypto because 1, this capsule is the main virulence factor making the fungus anti-phagocytic, and 2, it's the basis for one of the diagnostic tests, which we'll discuss shortly. Now let's talk transmission. So crypto is normally found in soil and is often contained within pigeon droppings, which is a buzzword. After it's inhaled, it settles in the lungs as a primary focus, and from there it'll disseminate elsewhere. To remind you of pigeon droppings, we've drawn a couple pigeons in our crypt with several of the droppings all around. The archaeologist is coughing to remind you that it enters the body through inhalation and sets up its primary focus in the lungs. Lastly, to conclude general characteristics, you can see that the archaeologist is holding a spray bottle. It's been a while, but do you remember what this spray bottle was a recurring symbol for? Yep, it's to remind you that crypto is urease positive, so fungi can actually be urease positive too. Though this is a pretty insignificant detail to remember, it is something that separates crypto from a lot of the other fungi. So when they throw you a bone and say urease positive and you're thinking that the presentation sounds fungal, you can start thinking crypto. Also, of course, remember that crypto is an opportunistic infection. Thus, most of the symptoms we'll be discussing are in immunocompromised people, especially people with HIV or with malignancies or those on high-dose steroid therapies. And here you'll see our symbol for immunocompromised status. Of course, it's the cane, and we'll give it to this mummy here. Remember that more often than not, you'll see this associated with patients with HIV. So let's go through the clinical symptoms by organ. Let's start with the pulmonary symptoms. After settling in the lungs, the infection can be asymptomatic, but it does have the potential to cause cough, dyspnea, and other serious lung infections, which we've kind of already demonstrated through our archaeologist coughing. It'd be unlikely that crypto will be caught in this stage, however, and will likely progress to much more worrying symptoms. And one of these more worrying symptoms, one of the really big killers to worry about, is that it can spread to the CSF and cause meningitis. And in fact, it is the most common cause of fungal meningitis. So just like our previous drawings, how we represented meningitis or that stiff, painful neck from meningismus, we'll demonstrate this with a neck brace, and we'll add it here to our archaeologist. And just to impress upon you, cryptococcal meningitis is no bueno. At best, it means that a patient will have to endure a long treatment course, but very often it can lead to permanent neurodeficits and can absolutely be lethal. And then finally, we'll make our archaeologist sweating to demonstrate fever. So he alone embodies all of the clinical findings we need to worry about. Again, those are fever, cryptococcal pneumonia, and meningitis. So let's move on to diagnostic tests. Like all other fungi, culturing is done on Sabarod's agar. However, it takes weeks to come back, so that's not very helpful. So let's not talk about that. Instead, you can use bronchopulmonary washings of lung tissue. These soap bubbles on the mummy's chest are here to demonstrate these bronchopulmonary washings. Tissue samples are stained with either mucicarmine, which is a red stain, or with a methenamine silver stain. To remember these colors, red and silver, we've colored in the stripes of the sarcophagus with red and silver alternating stripes, like so. Okay, let's move on to talking about how to diagnose cryptomeningitis. So, of course, first you'll need to do a lumbar puncture, and then the CSF gets stained with a stain called India ink. And this India ink will stain the background dark while the organism remains transparent. Thus, it's a negative staining technique. And what will be left are 5 to 10 micrometers of yeast with wide capsular halos. Remember I said they were very heavily encapsulated? Well, these are those halos. So to illustrate this India ink, we have a vat of bubbling tar or ink with small circles with halos floating around. So we've really tried to make this look like what the stain will look like. You may want to Google a picture just to make sure that you really recognize it. So definitely familiarize yourself with this imagery, because if you have a question on crypto, they are very likely to include a picture of it with India ink staining, because it is so unique. So this test is not very sensitive, and you'll probably be tested on a better diagnostic test called the latex agglutination test. This latex agglutination detects the polysaccharide capsular antigen and causes agglutination. This latex agglutination test detects that repeating polysaccharide capsular antigen I talked about earlier and causes agglutination. We'll demonstrate this test by giving our archaeologist, who is cleaning the lid of the sarcophagus, latex gloves. The gloves are next to this repeating pattern, and that should enhance the association of latex agglutination with the repeating polysaccharide antigen. So after invading the CSF, crypto causes some distinct gross pathology of the brain that can be seen on imaging. This pathology is referred to as soap bubble lesions in the gray matter of the brain. This is an important buzzword you should remember, and with all the washings and scrubbing this mummy is getting, which we said was to represent bronchopulmonary washings, we're going to add some distinct soap bubbles to the head to remind you of these soap bubble lesions. So to recap, the washing on the chest should remind you of the bronchopulmonary washings, which is a diagnostic test for crypto. And then the latex gloves paired with the repeating patterns of circles should remind you of the latex agglutination test. And finally, these soap bubbles extending on the head of the sarcophagus should remind you of the soap bubble lesions seen on imaging in someone with cryptococcus meningitis. So in total, we've talked about 4 different diagnostic tests, 5 if you include culture, to diagnose infections with cryptofungus. This will probably be the most tested concept of crypto, and is probably something you should review again. Okay, to finish up, let's talk about treatment. Treatment of cryptococcus meningitis is pretty laborious, and not like our usual fungal treatments. It is important to know that the treatment consists of joint therapy with amphotericin B and a drug called flucytosine. And then this combo is followed by a maintenance therapy with fluconazole. To remember these drugs, we'll use our recurring symbols of frogs for amphotericin, drawn here on the walls, and a pinecone carving on the wall to represent fluconazole. Flucytosine will be represented by a flute, which is being played here by the hieroglyphic men. Notice how the frogs and the flute are together, and then this is followed by a pinecone carving. And this is just like the order of treatment, with amphotericin and flucytosine together, followed by fluconazole. Alright, that was a lot of information. But again, you're likely to get the picture of cryptococcus stained with India ink, or an HIV patient with a CT of the head showing soap bubble lesions. So really familiarize yourself with that imagery, like I said before, and you'll be golden.